So Brian, thank you so much for being with me. Sorry, Dr. Brian Kaplan. I've known you for over a year now, and you are one of the best doctors in America. So I appreciate you being here and letting me ask you some questions.
It's my pleasure.
So we're going to talk today about fertility. And there's a lot of people who don't, either they're scared to ask questions about fertility or just don't know where to start. And so for you, can you kind of walk me through your patients, age and demographics and who you see?
Yeah, so infertility is defined as 1 year of unprotected intercourse. So if a couple's tried for a year without contraception, it doesn't have to be meticulous, but that's how we define it. The most critical variable of all of this is the age of the woman. And I think that's very important. As women age, their eggs deteriorate, both in quantity and in quality. So for me, the time is the most important factor in infertility. And so when someone should seek infertility is based on the age of the woman.
And so is that 30? Is that 25? Is that 40?
So I would say that if you have infertility, so as a couple you're trying to get pregnant, if you're above 35 years old, I would do that more expediently. So I would go to see a physician at 6 months. If you're under 35, you could wait for a year.
And when you say physician, is that OBGYN or is that a fertility doctor?
I would address it with your OBGYN as soon as you're trying to get pregnant.
Okay.
But I would seek a fertility physician at that timeline.
Okay.
But the world of infertility is interesting because it reflects society as a whole. Today we don't only have heterosexual couples who've been trying for 6 months. So we have a large gay community. We have, whether it's women or men or single women, single men. We have people seeking our technology because they carry a predisposition to a certain genetic disease. So it's not really pure infertility as a whole. It's many options that revolve around reproductive health. But we also talk about the millennial or the younger patient, and even some of the older patients, about being proactive and freezing their eggs. And men might want to freeze their sperm. So this world is very diverse. And so it's important for a multitude of a population. So when we talk about 6 months of trying, that's for the typical heterosexual couple, which might only be 50% of my population that I see.